Today we mark International Overdose Awareness Day. We stand together to honor our community members lost to overdose and support those that have been left behind. No one is immune to substance use disorders or mental health disorders, and overdose does not discriminate. Drug poisoning can happen to anyone, including people who use street drugs, people who use prescription medications and drugs incorrectly, and people who are experimenting for the first time. The presence of contaminated drugs in our community and the isolation and impact of the pandemic have significantly increased the risk of overdose in Hastings and Prince Edward counties. There were 29 deaths related to opioids in 2020, and from January to July of this year, already 20 individuals have lost their lives due to suspected overdose. In Ontario, more than 2,400 people died from opioid-related causes in 2020, and while preliminary, the number sadly rose to 2,800 in 2021. This is a time to remember, and it is also a time to act. We can take the steps to help reduce the stigma against those who use drugs. This International Overdose Awareness Day, I encourage you to recognize individuals as human beings first, regardless of what their practices may be. People who use drugs and those who have experienced overdose are members of our community. They are our brothers, sisters, co-workers, and friends. Let's stand together to understand the struggles of addiction and work to build a more inclusive and caring community.